So, Dr. Gersh, who are you and where do you come from?
I am a board-certified obstetrician gynecologist, but what makes me a little bit, or probably very unique, is that I'm also board-certified in the new field of integrative medicine. So for many years, I've had my own private practice, and I practiced doing surgeries and delivered thousands and thousands of babies. But then about 10, 11 years ago, it was my time to stop doing deliveries because I'd been really sleep deprived for 25 years. And as I really had more time on my hands and I started looking at what I was doing now that I was just doing gynecology, I demanded that all the pharmaceutical reps that came through my office show me their drug studies. And as I really came to see the pharmaceuticals that I was prescribing for what they really were and what they had to offer, I realized that their efficacy, when I balanced that with their side effect profile, was really not adequate to what I was trying to do to help my patients. And I was doing a lot of surgery, but that's really dealing with end-stage disease. And I wanted to help prevent that. I mean, I would tell women in the past, like, well, you have uterine fibroids. If they get really big, we'll just cut them out. I'm like, why can't we do something about that so it doesn't go down that path? So I ended up, after taking a lot of courses I became really a seeker. I took the fellowship. I entered at the University of Arizona School of Medicine, their 2-year fellowship in integrative medicine, which I completed in 2012. So then I became board certified in integrative medicine. And now in my practice, I incorporate the whole array of therapeutic tools that integrative doctors have. I incorporate lifestyle, fitness, nutrition, herbals, mind-body medicine, we have massage. So we have a very large therapeutic toolbox so I can help all of my women patients to achieve optimal health.
So, in this 11 years of experience, what are the things that really stand out that you wish you had known and that the patients you had worked with, especially women, had also known?
I would say that the most important thing that really came about in my understanding of the female body is that the prime directive of life is really the creation of new life. And every system in the female body is designed to support reproductive success. We have such confusion in our medical world and also among the public who think that reproductive functions of the woman are separate from every other function. So you could just like cut it off, or you could poison it, you could do whatever you want, just get rid of it. And the rest of the body will just keep humming along. But that isn't how it works. And when you really think about it, of course that isn't how it works, because nature wants reproductive functions to be successful. You don't want a woman to get pregnant and then they both die, or the woman can't nurse the baby long enough to be a healthy child and then develop into a full-blown adult, mature sexually adult person that could then reproduce themselves. So, of course, all the systems in the body are designed for successful reproduction. So estrogen, which is the master of metabolic homeostasis in the woman, has receptors in every organ of the female body. It's in the brain, in the skin, in the lungs, in the bladder, in the arteries, in the heart. You can name any organ, and estrogen is there doing vital functions. And of course, the reproductive organs, and it's all coordinated together to work so that one beautiful, healthy female can be reproductively successful. Now, we are the only creatures on the planet that try to control our reproductive functions.
Yeah.
You know, you take dogs, they want to mate. You take any animals, and they just make new animals, or plants, make seeds. It's humans that want to control their reproduction. And female health has been harmed so greatly because of this lack of understanding that reproduction and metabolic well-being, and metabolism is all about energy. It's really the life force of a woman, of a person, that metabolism and reproduction are one, and you can't sever off reproductive functions and then leave the woman intact. And that's what we've been doing by giving women all kinds of different chemical contraceptives, thinking that we could just take away estrogen from the body, eliminate reproduction, and everything is going to hum along. And that's really key to what's happened in women's health, including pain issues.
What you're saying here is quite profound and should be obvious, but it's not many times. There's a relationship between metabolism and reproduction. And of course, as a woman is aging and reproduction changes and hormonal shifts happen in the body, that's one thing. But there's also young women who indiscriminately are taking oral contraception, which is going to impact their chemistry, which will impact their hormones and their metabolism, etc. So this becomes a big women's issue. Before we get into pain completely, can you talk a little bit more about this? Because I think it's relevant.
Well, I have to educate my patients because they don't understand this. Most doctors don't have a clue about how a woman's body really works. So women's hormones are very dynamic in their health. So optimizing hormones is really about optimizing health. So hormones are messengers. They deliver information to cells so cells can know what to do. If you don't have the right hormones, the messages don't get there. The cell doesn't know what to do, what enzymes to produce, what kinases. The whole process in the cell is so complex, but it's all centered around getting estrogen into it. So as women go through life, their hormones are going to change. So reproductive lifespan is not infinite for a woman. Nature made it so that every woman, it's universal. You cannot meditate your way out of it. You can't exercise. No matter what a woman does, the best she can do is prolong her reproductive lifespan, which, by the way, is really wonderfully important and healthy. We actually emphasize that in my practice, how to try to have the longest reproductive lifespan. Because once a woman starts going through the perimenopause or the transitional years and her hormones start fluctuating, it's really the beginning of hormonal changes and also health changes. Right. And this is also not well recognized that menopause, the word, is actually harmful because it makes it sound like the only thing that matters is when the period stops. And they made these just arbitrary definitions. Menopause is when a woman doesn't have a period for 12 months. Well, what's that, written in stone? That is just an arbitrary thing that humans made up as a definition. Menopause, if we think of it as what it really is, ovarian senescence, the dying out of ovarian function, that is a gradual process. It's not a moment in time. It's a transitional thing. So we should really think of menopause as a process, not a moment in time. And the process begins as reproductive functions decline. So every woman knows that her ability, her chances of getting pregnant and having a healthy, uncomplicated pregnancy is greater in her early 20s than in her late 30s. So this ovarian senescence is a gradual process throughout the life of the woman. But when you get towards around 40, 45, things really start escalating in terms of the decline of ovarian function, which mirrors, of course, reproductive function. So there's a beautiful slide that I have in many of my talks that shows the connection between mitochondrial health, reproductive senescence, and metabolic dysfunction. And because there are estrogen receptors throughout the mitochondria, the energy powerhouses of the cell. And as estrogen levels decline, the mitochondria become less capable of creating energy. And as I mentioned, energy is the force of life. Like, what's the difference between us and a rock? We create energy, whereas a rock can only reflect energy. So, in essence, as we age, the entire female population has declined innately. It's inherent in our bodies that our ability to create energy declines as we go through these phases of ovarian senescence. And of course, that translates into tremendous health effects in every organ of the female body. So what I do, as I mentioned, I try to help women to prolong their ovarian function. And you can do that through all the lifestyle things, by having women eat lots of great varied vegetables for the polyphenols, for the antioxidants, exercising, getting adequate sleep. And there's some interesting studies that have been done on non-human primates where they did periodic fasting, which I am very big on because I understand how it really can help to restore health in so many ways. But in these, now this was not humans, so these were like monkeys, but they did periodic fasting from a young age, like starting in what would be the equivalent of a human in their 20s. And they did this periodically, and they prolonged their reproductive functions. So how wonderful is that? Because not only does it potentially give women more opportunities to get pregnant as they age, but it will prolong the lifespan of the ovary and the wonderful and critically important hormones that are produced in the ovaries. But as women inevitably will lose their ovarian function, and I can't prolong it indefinitely, then I am very, very big on giving hormones back. Now, I recognize, of course, that's not natural, but I don't care. There's a lot of things, everything we do in medicine is not natural. Why does nobody question giving artificial limbs or replacing joints or doing implantables in hearts like defibrillators? Like, how about replacing lenses that become foggy? So those are cataracts, right? So nobody has a problem with all the surgical manipulations that we do. There's nothing natural about them. So why not be proactive, understanding what estrogen really does in the body? Why not give it back? And I'm actually working with a nonprofit foundation now. We're starting in 2019 studies on women looking at replacing hormones to try to mimic the hormones of a healthy 25-year-old. And they've done some data with men that if they give, an unhealthy, typical 65-year-old male the hormones, the testosterone of a 19-year-old, that even with nothing else changing, that the man loses visceral fat, he feels cognitively improved, all kinds of wonderful things happen. If we can give women hormones to mimic the hormones of a young, healthy woman, that's the age when you have optimal health. So we should aspire to try to recreate that. Now, the reality is we never will. The ovarian function is so complex. We can't create a new ovary. So we have to do the best we can. And so no matter how we replace hormones, it's not like getting their ovaries back. They're gone, but we can still do better than what we're doing now. And we can talk forever, because I love the topic of what hormones do and the fact that we're doing it so wrong right now. We're giving static hormones, and of course women, their hormones are never, even when we give hormones in menopause, they're, like I said, static, but women are never static. Their hormones go through this beautiful rhythmic lunar phase, where they go up and down with ovulation, and afterwards the progesterone comes out. It's never static. And then in menopause, we're giving women static dosing. So we now know that the rhythm of hormones has an impact on the hormone receptors. So, for example, when a woman spikes her estradiol level, which precedes ovulation, that upregulates the receptors for progesterone and testosterone and thyroid. And without that beautiful rhythm, you actually have malfunction of those receptors, so that, for example, women in menopause may have, on paper, perfectly normal thyroid levels, but they all come in and they have all these symptoms, and it's like they read the book on hypothyroidism, and the doctor says, well, your levels are fine, you just are depressed, or there's something wrong because there's nothing showing here with your thyroid. But if they don't have that beautiful rhythm of the hormones, their thyroid receptors are not working properly. And it doesn't matter. I always use this analogy. If you buy a bunch of mashed peas because you think your baby loves mashed peas, but the baby hates mashed peas, you can have a huge supply, but if the baby closes the mouth, aka the receptor, it doesn't matter how much you have, it isn't getting in. So if you have plenty of thyroid hormone, but the receptor isn't receiving it, then the outcome is the woman will have all the symptoms of low thyroid. So I'm hoping that in the next year or two, we'll actually have some real data to hopefully prove the hypothesis that by trying to mimic as close as we can hormones and their fluctuations, their beautiful rhythms of a healthy 25-year-old woman, we can help to maintain that level of health, or as close as we can, in a woman who is 55, 65, 75. Where's to say? We know that our cells, they don't know how old they are. You take a cell. Does it say, oh, I'm in the body of a 65-year-old, so I'm going to behave differently? A cell has the same genetic programming at age 65 as at 25. The difference is what I call accumulated deficiencies, nutritional deficiencies due to the aging gut, poor diet, and hormonal deficiencies. So if we can try to mimic the same state of being of a 25-year-old as people age, maybe we can help. And we can incorporate as well all these other new tools like fasting and so forth to really extend what we call health span. Because it doesn't matter if you live to be really old if you have no quality of life, and that's what conventional medicine exceeds at. They're just they excel in terms of really helping people to live long but really poorly. And that anyone who's been to a nursing home knows that's not their goal in life, is to end up in a nursing home the last decade or any portion of their lives. So that's how I try to work with my women patients through every aspect with my integrative toolbox to maintain every aspect of their lifestyle to optimize health, and then doing what I can to try to keep their functions on par with a younger woman, even though they are losing their ovarian function, and I know what that means. And I know this sounds kind of heartless or cruel, but I don't think really nature cares about what happens to women after reproductive senescence has occurred. And if you think about other life forms, we think we're so special, and I think we are too, but we're still a life form on this planet. For example, there are certain species of an octopus, and octopus, they're nice creatures. They lay their eggs, and then they die. People know that salmon can swim upstream, they spawn, and then they die. They're species of spiders, I think the black widow may be one of them, that after they mate, the female eats the male or kills the male. There are other species of spider where the male kills the female. There is this wonderful thing about nature. It's about life and about creating new life. And I think once a woman has served her purpose, whether she's had children or not, once she's reached the end of her reproductive function, there's no grand purpose. We have to define our own purpose as humans. And so we have to help women. But we can't help women if we don't understand that there's an underlying universal issue that happens in menopause, which is loss of ovarian function. And with this loss will come inevitable decline in mitochondrial function, in her circadian rhythm. Estrogen is the master of the circadian clock. And women, essentially, from menopause on, live in a chronic state of jet lag. People know that jet lag is bad. And if you take women who are in a jet lag situation when they're younger, for example, they're nurses working at night or flight attendants working at night, they have much higher rates of what? Depression, metabolic syndrome, breast cancer, all these things. So we know that younger women, when they get put into a state of chronic jet lag, essentially circadian rhythm dysfunction, they have high rates of all the problems that accompany dysfunction, like I mentioned. And the same thing happens to women in menopause. So if you look at the large array of physical ailments that women in menopause suffer, when you look at insulin resistance, metabolic syndrome, by the age of 75, 85% of women will be hypertensive. Women have higher rates of stroke. They have more incidence of acid reflux than males do after. They have more insomnia, more depression. All of these things are very intimately related to circadian dysfunction. And this is going to happen in every single woman as she goes through menopause. So we have to first understand what's really happening in female bodies as they go through menopause. And that with estrogen having widespread functions and then levels go down. Now, men should love estrogen as much as women, but men make estrogen very differently in terms of where they make it in terms of quantity. Most estrogen in the body is actually made on site in organs. Most organs in the body make estrogen. That's called a paracrine function. So the organ makes the hormone for its own use. In women, it's also made as an endocrine. Endocrine means it's made in one site and then it's transferred through the bloodstream to other sites for action. So men make tons of estrogen. Men make 6 to 8 times as much estrogen, estradiol, in their brains as do women. That's why women have almost 3 times the incidence of Alzheimer's as males, because women make estrogen in their brains too, but not as much as men, because they get all the additional estrogen to their brain from their ovarian production. But after menopause, of course, the ovarian estrogen production goes down to nothing, and the brain doesn't pick up the difference. In fact, there's one study I saw that showed the brain actually made even less estrogen. So women live in a state of estrogen deficiency in their brains, and of course, the master clock that regulates all the other clocks in the body is located atop the optic nerve called the suprachiasmatic nucleus, which sits in the brain in the location called the hypothalamus. So what else is in the brain that's regulated by estrogen? How about appetite? How about all the metabolic functions? So after menopause, women often have dysregulation of their appetite, and they are always hungry, or they crave food at night. And because they have circadian dysfunction, they often have high levels of cortisol at night when it should be low, and they'll often say, I feel so much more energetic at 9 o'clock at night. And they say, I'm just a night owl. Actually, that person who's saying that, they have circadian rhythm dysfunction. They're tired in the morning, they need lots of coffee, and at night, suddenly they sort of wake up and they feel better. That's because they have flipped circadian rhythm. And we know that in just 8 days of flipping the circadian rhythm, where you have like noon become midnight, you have increase in insulin levels by 22%. Sleep efficiency drops by 20%. This is what happens to women. That's why after menopause, women inherently become insulin resistant because of their essential circadian dysfunction. So can I fix it? Of course, no one can change that we're all going to go through menopause, and we can't give back ovaries. But there's so much more we can do once we understand what women are really going through, and that the solution, which is offered, like Prozac and sleeping pills, Ambien, and, even drugs that are trying to help with the insulin resistance, like metformin, they're not getting to the underlying issues. And we can do so much better for women, because so many women are suffering throughout their lives because of other issues like endocrine disruptors and oral contraceptives. But when they hit menopause, it's universal that every woman is going to have some issues to deal with. If a woman hits menopause and she has significant reserves because she already has a lifetime of health, optimal bone, optimal muscle, that she has, reserves, then she can get through menopause better. Right. But now we have women hitting menopause, and they already have osteoporosis. They haven't even gone through menopause because the peak bone-growing years, which are the late teens and the early 20s, they were on oral contraceptives, which precludes the ability to make adequate bone. So when they hit menopause, they do bone density and say, oh, you already have severe osteopenia, or you already have osteoporosis. It's not because they lost bone, they never made it. So it's like hitting retirement, you never saved a dime, and then you look at your bank account and there's nothing in it. How are you going to survive through your retirement years? We women are not looking at it that way, that you have to build and save and have a really healthy body so that when you hit menopause, you can actually get through the next 30, 40, 50 years and actually still have a quality life.
That is fascinating. Jeff Hayes, the producer of this docuseries, his sister is a PhD and studies this a lot. And a question he asked her is, why do women not die after they're done with reproduction from an evolutionary standpoint? And she said that grandmothers were needed. Grandmothers delivered the babies of the daughters and helped raise the kids. So from an evolutionary standpoint, women were needed more than older men. We have that genetic imprint.
Well, I think that is beautiful, but once you get past reproductive function, there's no evolutionary pressures to do one thing or another. So I think it's that there really is no purpose to immediately killing off people. I mean, I like to think that, they're still useful. And but if you look at ancient burial grounds, there's no bones that really go past around 60 or so. So I think women had about a decade after menopause.
Looking at it through this lens that you have, that makes so much sense. Let's talk about pain and how you work with specifically women in treating pain, and what the normal treatment is, and how that may have strayed away from what is considered healthy.
So it's very important to recognize that women and men are very, very different in so many ways, and pain is included in that. So if we get back to it's all about reproduction and successful reproduction, the first thing with that is that women have very different immune systems than men, and pain is all about inflammation. Pain is a response to inflammation. And inflammation is the immune system. It's all about releasing inflammatory cytokines. So inflammation is part of survival. So women are much better at creating inflammation for survival purposes than are men. So let's think about that. Women have much more robust immune systems than do men. They have higher levels of antibody-producing cells. Their mast cells, which are the first responders of the innate immune system, they are more, we'll say, on edge. They have a lower threshold to rupture and release their inflammatory contents. So mast cells are the first responders. They line all the interfaces between the body and the outside world, like the skin, the sinuses, the entire GI tract, the lungs, in a female, the vagina. So all the interfaces, like the epithelial surfaces that are between the outside world and the internal body, there are all these mast cells. In females, they release their contents with a lower stimulation. Now, why is that? Because it's more important for females to survive than males if there's an infection. I know that sounds, well, why would that be? Because it takes a tremendous amount of energy to run an immune system. And women have, like I mentioned, more robust immune systems. They respond more. They have there are these things called toll-like receptors. They are like the antenna. They're the receivers for toxins, and that communicates to the immune cells, which then tell the other immune cells. So it's how the immune cells understand what's happening. Like there's a bacterial invasion, there's parasites, there's viruses. They're connected through these receptors called toll-like receptors. Females have more of them. They work more. Women have more dendritic cells. These are the dendrites are the immune cells that interface between our innate immune systems, the ones that are the first responders, that they don't care what's going on. They're just going to kill. They're like, something's coming. We're going to release our inflammation, or we're going to try to kill it. And then the adaptive immune system, which are the more specific antibodies. That's the communication between the two systems goes through these dendritic cells, these dendrites. And women have more of them. They have more toll-like receptors. We have more robust, more aggressive immune systems for the purpose of keeping females alive so that they can be successful with their pregnancies, nursing, to fight off breast infections, and so on, and epidemics. So they have to be there to raise the children. If you had a massive epidemic and you had 10 females survive to every male, you could still have the society continue. But if you had 10 males and 1 female, that isn't going to work, right? Mm-hmm. So nature understood this. So tremendous amounts of energy go into the female immune system, and testosterone is actually an immune suppressor. So males who have so much testosterone, it actually suppresses their immune system. And males, on the other hand, use a tremendous amount of energy to maintain their muscle mass and their bone and their larger stature. So it's all about limited energy and where it's going to be used. So females, once you know that women have very different immune system than men, that they're more aggressive. And women, for example, are even without the estrogen, like children, girls, little girls, and obstetricians knew this right away, have a higher survival rate than boys. Right. Because there's actually a lot of activity involving the immune cells. The genes are on the X chromosome, and females have 2. And one is supposed to have all the genes repressed, but that isn't happening. It turns out that at least 15% of the genes on the, we'll say, unused X chromosome are not actually unused at all. And most of those genes are involved with immune function. So estrogen is very involved in the immune system as well. All of the immune cells, mast cells, macrophages, neutrophils, the T cells, the B cells, all the cells of the immune system have estrogen receptors on them. And so it's very, very complex, but females, because they have a much more robust immune system, when things go wrong, they go wrong in a bigger way. So females are more likely to survive epidemics. Females are more likely to survive sepsis. That's a fact. And it's for the purpose of reproductive success and having women there to raise the children. But when things go wrong, which is happening now at epidemic levels, women are more prone to developing autoimmune diseases. So 80% of autoimmune disease sufferers are females. That's not an accident. It's because females have these just more aggressive, more robust immune systems, and when they respond to abnormal, like antigens, for example, we call them neoantigens. So if you eat food that has chemicals in it, the proteins of these chemicals can actually bind with the real food, creating what are called neoantigens, which the human immune system doesn't recognize as food, but rather recognizes it as some foreign invader. And if you have a leaky gut, which is impaired gut barrier function, which is also unfortunately very common these days because of our environmental toxins, our poor lifestyle, high fat, high sugar diets, and so forth, they all predispose to leaky gut, as do, by the way, birth control pills, because they are not normal hormones, they're chemical endocrine disruptors. They also predispose to leaky gut. And then you have these neoantigens coming through, and the immune system, the gut-associated lymphoid tissue that lines the gut, 70% of the immune system is right there lining the GI tract. The immune system over time is activated and it reacts against these neoantigens, and some of these proteins have some similarity and they can actually turn into antibodies against self. So over time, these neoantigens can lead to the production of self-antigens, where the body attacks itself. And so this can lead to some of the big issues that women experience. For example, rheumatoid arthritis, which is so disabling, so crippling with the pain that women can experience. And as well, because women have this very different immune system, they are more robust at creating inflammation. So they create more autoimmunity. They also create more inflammation. So when you have an irritation or you have tissue that's degrading with age, and the body has to deal with it. So when you have dying tissue or unhealthy tissue, the immune system is activated to deal with it. So women have a greater response to injury, to infection, to all of these things. So women have higher rates of arthritis, and because they have more inflammation, they have higher rates of pain. So women have more pain than men. And it's all based on, not because they're sissies, it's not that at all. Their immune systems are so different from men, they create more inflammation. And as I said, inflammation is pain. So I see women dealing with autoimmune-related pain. For example, they may have rheumatoid arthritis. Women have much higher rates of osteoarthritis. Women have much higher rates of migraines. And that's actually a form of neuroinflammation. And women have lots of pelvic pain. And this is very poorly dealt with. So women have many pain issues involving the pelvis: endometriosis, interstitial cystitis, pelvic floor dysfunction. So there's a lot of chronic pelvic pain. And then, of course, dysmenorrhea, menstrual cramps. Mm-hmm. So when you put it all together, women have menstrual cramps, endometriosis, pelvic pain from a variety of underlying issues, joint pain coming from a variety of issues, migraines, headaches. This is a lot of pain. And they also have, related to their musculoskeletal system, more tendinitis and arthritis that can affect the back. So they have a lot of back pain. So women suffer with a great deal of pain. So it's, I think, something like the biggest reason why patients go see doctors is because of pain issues. And in terms of the GI tract, women have much higher rates of irritable bowel syndrome, which creates, of course, a lot of pain. There's a lot of cramping, abdominal pain. So there's pretty much pain divided among every single spot in the body that women have to deal with and experience.
So based on your holistic approach, and I assume there are a variety of answers for a variety of issues, but applying your holistic perspective, how do you help women that come to see you specifically for pain?
Foundationally, I approach all these different types of pain in the same way. That's the beauty of looking at things from an integrative or functional approach. You see the unification of the body. So you see that the pain may be expressing itself in this organ or this spot, but the mechanism is the same. It's inflammation. So I want to put them on the most anti-inflammatory diet. I want to help repair the gut. I need to calm down that inflammation that's going on in the gut from the impaired gut barrier function, the leaky gut. So I want to put them on a high fiber diet. We need to nurture the gut microbiome. We know that so much of this inflammation begins in the gut, or all these interfaces. So we have to look at sealing these interfaces where all these innate immune cells, the mast cells and so on, are lining, waiting to release their inflammatory contents. So we need to calm things down. The first place we start is with the gut. So I am the opposite of what some people are in terms of the diet. I give a very high carb diet, but these are not processed carbs. There's never a processed carb in sight, no sugar. It's all things like vegetables, especially root vegetables and whole grains. They have to be organic, unprocessed, nothing powdered or pulverized, and beans, lentils, nuts and seeds, so a very high fiber diet. Now, I would say there are exceptions to this. If someone has a very ill gut, like they have ulcerative colitis, they have tremendous problems going on in their GI tract beyond what I've discussed, those people may have to have a gentler diet. So they may have to eliminate some of the foods that have lectins to begin with, like the beans and the nuts and so on. But that's, exception. So for the bulk of my patients, I want them to nurture their gut microbiome with lots and lots of fiber, what we call prebiotic foods. Because what happens is when these fibers come into the gut, they're fermented by the bacteria and they produce these products called short-chain fatty acids. And they go to the liver. They act as signaling agents to the liver. They help to regulate the circadian clock. Butyrate, one of the short-chain fatty acids, can actually help to entrain, that's where we used to train, but we say entrain, the clock genes of the liver, because we have the master clock. We also have genes containing clock genes throughout the body, and we can help to regulate this dysfunctional circadian rhythm that so many of us have, even when we're not in menopause, by eating at regular times. So that's the next step. So I make sure I feed my gut microbiome, and then I want to do time-restricted eating. This will also tremendously nurture the gut microbiome, help to set their circadian rhythm, and reduce inflammation. So I try to have people have a very large breakfast, sort of like dinner for breakfast, and then to be practical, because the best is probably to eat a big breakfast, a moderate lunch, and an almost invisible dinner, but people aren't going to do that. So I say a big breakfast, a very, very small lunch, and then a moderate, early, if possible, dinner, stopping feeding by around 7 p.m., 8 p.m. at the latest, at least on most days. By doing this and setting the circadian rhythm, we can actually reduce inflammation. It turns out that all of our immune cells have clock genes as well. The innate immune system is more active in the morning. That's why women, for example, with rheumatoid arthritis will typically awaken and have a lot of pain in the morning. That's their worst time because the immune system is most active. But by calming the immune system, by reducing systemic inflammation, healing the gut, and doing time-restricted eating, we can help to modulate that inflammatory response and lower it. In addition, I incorporate fasting, and there's a lot of anecdotal data, and we're going to hopefully have studies to actually prove this, but there's so much effectiveness that has come out that you can reduce pain significantly by doing periods of fasting. And it seems to help reset the microbiome. It seems to also increase gut diversity in terms of the bacterial populations. It also seems to help set the circadian rhythm. So I use the fasting mimicking diet that was developed at the University of Southern California's Institute, the Longevity Institute. And I have found that has tremendously reduced pain. Doing what I've said, I can usually reduce pain by about 50% at least. And I'm talking about within 2 months. So I think that is fantastic. Now, in addition, I use a lot of mind-body medicine because we know that we can really change how the body responds by changing our brain function. And so my personal favorite, there's many, many mind-body medicine techniques. My personal favorite is actually guided imagery. And guided imagery, I don't have to train anyone. No one has to take courses. You can buy these. They're very cost-effective, and they're like a way to go into a state of self-hypnosis. And there, it's phenomenal, the impact that it can have on pain by incorporating guided imagery. It's like a guided meditation. You listen to a beautiful voice and music, and it tells you to imagine a beautiful place where you've been. It could be real or imagined. And then it takes you on a journey, and it helps to actually alter your immune response. You can actually lower your immune trigger so that your immune cells don't explode as rapidly with the inflammatory contents. And you can sleep better, and we know sleep is so important for healing. So we always want to include mind-body medicine. I also love yoga. So one of what is almost like an undiscovered, unrecognized organ of the body is called the fascia. And the fascia is like an inner skin, and it has a honeycomb with gelatinous material, and it actually transmits signals and waves throughout the body, and all the nerves and all the arteries pass through the fascia. And one of the reasons I think that yoga is so effective for pain is that it actually moves the fascia. When it's unused, when we sit and we don't move our body in all the different ways that it's designed to move, you actually get fibrosis within this honeycomb gelatinous material. And some people feel it as like knots. But those knots are really fibrosis, and you can massage them out, which is another thing I use. I have a fabulous massage therapist in my practice, and myofascial release, where you're actually rubbing out and opening up that fibrosis, allows the nerves and arteries to function properly and to have the signaling through this honeycomb gelatinous material to properly transmit information throughout the body. So yoga is fantastic for fascial health. Massage is really wonderful. Guided imagery and working on nutrition, time-restricted eating, and fasting are all obviously very, very key. The other thing that I'm exploring, and this is my 2019 mission, is to become incredibly expert on the role and the use of CBD and all the different types of cannabis and the role of the relationship, the percentages and the ratios between CBD and THC, and how to really optimize this amazing plant for use in treating pain in my patients. But what I've focused on this past year is really getting to understand the innate system, the endocannabinoid system, which actually is what the cannabis and so on works on. It's like a miracle of nature that a plant can have components that actually bind to receptors in our own body. And we know this has happened with phytoestrogens, for example, soy and flaxseed, which can actually be, and I didn't mention that, when you have whole organic products, they can actually be helpful because they can bind to estrogen receptors in the gut and help the gut to be healthier. And a lot of people don't understand that about soy because it's been so processed and so much of it is GMO. But when you get whole organic soy, the fact that it is a phytoestrogen means that it can bind to receptors and actually have good response. And that's really the same idea of using cannabis and hemp and so forth that have these amazing plant-based cannabinoids. They can actually bind to our own innate system. But first we must understand our own innate system. And the amazing thing that I've learned is that, not surprisingly, once you understand that everything's about survival and reproduction and estrogen in women, that estrogen has a tremendous role in the functioning of our endocannabinoid system. There's an actual feedback system, a loop between the two systems. And estrogen is actually an anxiolytic. Estrogen reduces anxiety. Now, how does it work? It turns out it probably works by binding and working with the endocannabinoid system. And estrogen actually increases, higher levels of estrogen in the female body increase our own endogenous levels of the endocannabinoids. And the reason that it does that, the way that it does that, is by blocking the enzyme. There's an enzyme that breaks down our own endogenous cannabinoids. And that enzyme is blocked by estrogen, so that we accumulate more of these endogenous cannabinoids, our endocannabinoids, which are so important for immune health. That's why there's a lot of role in autoimmune system in terms of treating women with autoimmune disease, and in pain, because they're all interlinked through the immune system function. And so I'm very excited understanding how the endocannabinoid system links with estrogen. And it really has helped me to understand why women are suffering so much, because without estrogen, our own system of producing endocannabinoids is not working properly. So it's like a very elaborate thing, and it's very exciting, and I think there's an incredible future on the utilization of the products that are derivatives of cannabis and hemp.
When you say endogenous, will you define that for us?
So it turns out that we have this incredible system in our body called the endocannabinoid system. And this is a very, we'll say, ancient system. It exists in many other organisms that are of a lower, we'll say, level than humans. So it's been around for millions of years in other creatures as well. And the endocannabinoid system has many roles in our human bodies. There are receptors for these products called cannabinoids, or the endocannabinoids. Endo meaning it's within us, it's from us, it's not coming from outside. And endogenous means it's coming from within us. A lot of people don't realize that we make our own products that are actually similar to CBD, that are made in us, and that CBD is actually binding to our own receptors for our own innate produced in our bodies endocannabinoids. So there are receptors for these products, and there's two, and it's actually growing. It's more complex than what we thought. So, and there's different products that are involved in dealing with pain. It's a very complex system, and it's really just being learned. And it's very involved as well in reproduction. It's all interlinked. There are tremendous amounts of receptors for the endocannabinoid system on ovaries, the uterus, and in the female reproductive system is very involved with the endocannabinoid system. And the reason this is so important to recognize is that when women use cannabis, they can actually impact their own menstrual cycles. They can actually alter the way that the interaction between estrogen and our own innate system is functioning. And we now know that if a woman has THC, it can actually lower her production of estrogen. It can actually prevent ovulation. So we have to be very careful. That's why my foundational investigations are how does our own innate system work, our system work, so that when we add in the herbals, the plants, that we know what we're doing, because now that I understand that there's this complex interplay between the endocannabinoid system and estrogen, and that they up and down regulate each other. So if you have a lot of endocannabinoids, it can downregulate the production of estrogen, and estrogen increases the accumulation, the bioaccumulation of these endocannabinoids. And as well, it also seems to upregulate the receptor and increase production as well. But if you take something from the outside, if you take a product from cannabis, you can then impact on the way the body makes estrogen, and it can increase actually infertility. So we have to be careful about giving women these products for pain if they're also trying to get pregnant, for example. As well, if a woman uses these products and they are pregnant, like in early stage pregnancy, they can actually induce a miscarriage. And later on in pregnancy, they can actually induce preterm labor, because the endocannabinoid system is so involved with reproduction that our own production of endocannabinoids in the early stages of pregnancy is very low, and then it rises steeply preceding labor. So knowing that there's this beautiful rhythm and that there's different amounts of production of our own cannabinoids from our own body, that when we add in the plant-based ones, and we can interfere with the way the body works, we just have to be really cognizant that the female reproductive system is totally embedded in the endocannabinoid system, and that we can interfere with fertility, we can also induce miscarriages, and we can induce preterm labor. So we have to know what we're doing. And that's really my goal over the next year, is to really get expert on the use of all the products that come from the plant-based cannabinoids, and as well educate doctors and the public on how to use them properly, so that we can use them to help reduce pain and suffering and improve immune function and so forth, and possibly many other things in the body, but we don't interfere with the normal functioning of the body as an accidental consequence.
I'm excited to come back a year from now and meet with you again to see what you've learned in that time. A final thought. Do you want to go into the effect of oral contraceptives on women's health and their pain?
One of the things I'm very concerned about is the overwhelming use of oral contraceptives and other items that are used for contraceptive purposes, like implantables that have these progestins, levonorgestrel, and so on. Because now that we understand the incredible importance of having estrogen in the body and having these beautiful rhythms and how these all interrelate and how these are so key to proper functioning of the immune system, knowing that women are not getting proper estrogen and they're not having rhythms through some really critical phases of their lives. For example, birth control, first I need to make it very clear. Birth control pills have no hormones in them. They say they're hormonal contraceptives, but there are no hormones in them. In fact, if you go to the toxicology website of the National Institutes of Health, it lists every ingredient in a birth control pill, the progestins, the ethinyl estradiol, as endocrine disruptors. Environmental scientists call a spade because these are getting into the environment, they're getting into lakes and rivers, and they do studies on the impact on animal life. They call them endocrine disruptors, which is what they are. Their purpose, their design was to disrupt the normal production of hormones and the rhythms of women, which gives them fertility. Ancient people understood this. They worshipped fertility gods because they knew fertility was health itself. And now, because we don't want to have babies at certain times, which I totally understand. I mean, I don't want people to just rampantly have babies they don't want, but we have to understand that fertility and reproductive health is health itself for a woman. We can't just detach it. And when you take away women's hormones and you replace them with endocrine disruptors, which is what they are, the female body is going to suffer. These are slow poisons, just like many endocrine disruptors. Like men, for example, get exposed to phthalates. They're in scents, fragrances, plastic, vinyl, and so on. Male sperm counts are plummeting, but it's not killing them rapidly, but it's harming them. The same thing with oral contraceptives. It's not killing women. They're not falling over dead immediately or anything like that, but it's harming their bodies and it's setting the stage for many, many problems because all the systems in the female body are linked in some way with estrogen. So it's setting them up to have depression and arthritis and osteoporosis and cardiovascular disease and dementia later in life. And we know now that women on oral contraceptives have higher incidence of many forms of autoimmune disease like Hashimoto's thyroiditis and Crohn's disease and lupus. Once we understand these foundational issues involved with every organ in the body and how it relates to estrogen, and then we recognize that birth control pills have no hormones in them, then we can realize the seriousness of this issue. And of course, we need to develop much better, safer, and also efficacious contraceptives for women, but we can't just say this is too big to fail, even though it's really become the standard of care that 90% of women, at least, are on oral contraceptives during their lives. And it's changing the way their bodies work in so many ways. And as I mentioned, they have increased rates of autoimmune disease, suicide in young women, depression. They never develop peak bone mass the way they should. Their musculoskeletal system isn't right. And it's very important to have proper collagen in order to have healthy tendons and ligaments. Women have such high rates of osteoarthritis, and they just think it's just natural. And to some degree it is, but we now know that if you can increase the bone density of a woman by just 10%, you can actually stall the onset of osteoporosis by 13 years. So what we're doing when we give women oral contraceptives is that we're aging them prematurely. That's the best way to think of it. We're creating the onset of diseases of aging, but at an earlier age, so that women are more prone to injury. Like a lot of women they'll twist their ankle and they'll get like torn meniscus and things, and they'll say, oh, it just happened. But maybe that wouldn't have happened if the tissue quality was better to begin with. So it's not just bone that has estrogen. It's also all the ligaments and the tendons, collagen, cartilage, they all are related to estrogen. So we're not building the proper musculoskeletal system of women. And think about, where do most people complain of pain? It's in their musculoskeletal system, in the different joints and back and so forth. If we have women that never develop healthy, robust ligaments and tendons and bone and muscle, then they are being set up to have injuries at a lower threshold and develop severe disorders like osteoarthritis, which we now know is actually an inflammatory process. It's not, unless it's from an actual direct injury, it's really an inflammatory process. It's not just wear and tear at all. And all of this is related to lack of proper hormones during the really key developmental years. And as well, because it alters the gut, we know, for example, women who have severe migraines with aura should never take birth control pills. Well, that's because they're inflammatory. Birth control pills are bad for the cardiovascular system. If they were so good, we'd give it to every woman when she had a heart attack. And of course, that's the last thing we would give. So we wouldn't give them to smokers. So understanding that birth control pills increase blood clotting, whereas real estrogen lowers blood clotting, and they increase gut dysbiosis. They create more leaky gut, which is creating inflammation in the body, leading to more pain, because inflammation creates pain, and it creates pain in the head. It can exacerbate migraines. So we need to change what we're doing. I don't have the answer, but we can never get an answer if we don't define the problem. And so it's a really key message that oral contraceptives and other types of chemicals that are used for contraceptives that alter the normal hormone production of women. Because we know, for example, that when women use an IUD that's embedded with the progestin levonorgestrel, that over half of them will stop ovulating. They lose their rhythms. Even if they're still making some estrogen, they lose their beautiful rhythms, which are so necessary for proper health and function. So the real takeaway is that women are beautiful, dynamic creatures. They're very different from men. We have to stop thinking of them as little men. They're very different, with very different, very dynamic immune systems. Women are more prone to pain and more prone to mood disorders, sleep disorders, because it's all interrelated. And estrogen is the master hormone of metabolism, of metabolic homeostasis, and also the master hormone of reproduction. And all of these systems are beautifully intertwined. And we need to recognize that to maintain health in a woman, we need to have optimal hormones and, of course, optimal nutrition and control of stress, the whole everything, the lifestyle. And then a woman can live her life with health and happiness and pain-free.
I love your perspective. Thanks so much for doing this today.
It's been my pleasure. Thank you for inviting me.
So Ken, thanks for taking some time to speak with us.
You bet.
So tell us what brought you into treatment here.
They posted a comment on Facebook, I guess, and I went, this sounds interesting. Let's go to that. And the wife said, well, we'll see.
What was the challenge that you're looking for a solution for?
I have had a stroke 2 years ago, almost to the day. An ischemic, it happened in that side of the brain, and so this side of the body is affected.
So you're experiencing paralysis. Is there any pain or discomfort or numbness associated with it also?
There isn't that I recall. At first, I didn't realize that I had lost control over this side.
Right.
Then I came to my senses, although I couldn't articulate it.
Right. So what kind of solutions had you been looking for? What did your doctors and neurologists tell you that your options were?
They told me that if I hadn't gotten it back in 3 months, it was pretty much lost. And that was back at the time when they were still talking about doing stem cells, and my wife and I just went, we've got to do something.
So then you saw some discussion around the type of work that they do here,
Yes.
and that was about less than a year ago, I guess.
Yeah, 6, 7, 8 months ago.
And what did you? So what kind of services did you have done? What was the treatment for you?
They basically kicked me out of the hospital at 6 weeks and said, you have 3 months outpatient and the treatments were less than satisfying. They got me talking, but the right side of my body just wasn't coming around.
So after that therapy, and then they said at this point, that's pretty much all we can do for you?
That was basically it.
Yeah.
And the doctor and I said, well, we'll check up on you every month. And I started looking for other avenues.
So what did they do here for you?
They wanted to do 2 stem cell therapies. My wife got one of the 2 stem cell therapies. I got one. I still think that 2 would probably do a lot better job of
And
taking care of it.
was there anything, did they do any acupuncture or any other things?
They did
for you?
acupuncture once a week for 5 weeks, put me on a special diet, and just said, well, let's monitor it.
And what have you noticed in the way of changes, if anything?
I quit using my cane.
Oh, you were on it, you had a cane?
I was on AFO. I've lost that, and it just keeps getting better.
And you're still seeing results, progressive results happening right now. So was it what your expectations were, or below or above?
You know, expectations is one thing. I expect full recovery. So far, it's going pretty well.
That's great. Did anybody try to dissuade you, saying, you're wasting your money doing that? If the conventional, system of doctors, can't help you, this other stuff is, not going to do it. What kind of feedback were you getting from people?
A lot of naysayers
Yeah.
were involved, and they said, "Oh, you've had 3 to 6 months. You can't expect anything better." And I just said, "Well, so you say."
Yeah.
And so did all the rest of the world, but we're going to give everything a try.
Well, that's actually kind of interesting, because they were basically prognosticating, saying, after 3 months, that's what you got, and you're wasting time and money if you're trying to put it into this other stuff, because insurance is not covering this, right? You have to pay out of pocket.
That's true.
Yeah, and so it's a pretty good investment. But now at this point, as you say, you're no more cane. You're seeing progressive improvements still happening. And you expect to continue on for some period of time.
Yeah.
Anything else that you think is worth sharing about your experience relative to all this?
I'd say just don't ever give up on yourself. There's always somebody out there somewhere not willing to take your money for nothing, but that has a good product that it's going to work.
And it's interesting too, because a lot of this, and I've been seeing this as a recurring theme that maybe I wasn't anticipating as I was talking to many patients and providers through this whole process, is how much the mindset of the patient plays a role. Do you feel that way?
I think it does. A year ago, I couldn't talk like this. I couldn't articulate. And given enough time and earlier in the morning, it was a lot better. But this is after a full day of teaching school.
Wow, so you're back to teaching too?
Yes, I'm back teaching.
Wow, so that's impressive, but it seems also that if you didn't have a determination to not only get better, but have a full recovery, after the 3 months, you might have given up.
I can see that a lot of people do.
Yeah, and that's discouraging, that somebody's opinion
Yeah.
makes people give up when maybe there's some hope for them.
I think it's just tragic that the people that you're counting on, doctors and nurses, they just go, this is it. And you find that they are bound by legal precedent, and they can't say, well, there's other things out there.
Right.
I had to go into them and say, hey, I found this and this and this, and they'd say, well, yeah, it might work.
So with the stem cell treatment that you had, how were they given to you?
Intranasally.
Intranasally.
And so they took a long needle and they placed it in the nasal cavity, up high enough that it was basically touching the brain, although, they didn't actually physically get the brain.
Right.
It hurt.
I was going to ask, was it uncomfortable? It must have
Yeah.
been somewhat uncomfortable to go up there, right?
I felt like I'd been crucified, to put it bluntly. They hung me upside down and said, well, half an hour, we'll be back. And they came back, and I was never quite so relieved to get out of the upside down position.
I bet. But at this point, I guess it was worth that half hour being upside down, huh?
It was worth it.
Wow, terrific. Well, I certainly appreciate you taking the time to sit with us and tell your story and to share that so that people may understand that there's some options out there for them.
Yeah, there sure are. To have me back in a year, I'll be doing dances and playing guitar for you.
Terrific. I look forward to that. Thank you. Kim, thanks for sitting down to share your story with us.
I'm glad to.
So tell me what were your health concerns that brought you here?
My biggest concerns was I was having pain in my right knee, and I had had shoulder replacement surgery about 7 or 8 years ago, and I didn't want to go through the pain and the recovery of all of that again. And my wife had checked into stem cells, and I decided I was willing to try some other means to try to relieve the pain in my knee.
With your shoulder, was the surgery successful? In other words, did it repair the shoulder for you?
It did, but it took a long time of physical therapy and the pain and everything, and I just didn't want to go through that much again.
And how much pain were you in with your knee?
I would say on the scale of 1 to 10, I was probably at minimum 5, but usually more like 7 or 8 all the time.
All the time. And did you get a traditional orthopedic assessment, where they looked at it and said, here's what we think is going on?
Yeah, I talked with an orthopedic surgeon, and he said it's basically pretty much all the cartilage is gone. And he said when the pain gets enough that you don't want to do it anymore, then come back and see me, and we'll do a knee replacement.
Right. So was it at that point that you decided to look for alternatives?
Yes.
So stem cells came up on your radar somehow, I guess, to say, okay,
My wife had looked into it before for different reasons, and I figured it was a good time to check into that as a possibility.
And how long ago was it that you actually got the treatment?
The treatment was done last April of 2018.
Yeah, so we're talking roughly 10 months or so.
Yeah, it's about 10 months ago.
And what expectations did you have going in? What were you hoping for?
I was hoping to be free of pain. That was the big one. I've been active my whole life. Started sports when I was 5, played pretty much everything, and I guess my body was just kind of wearing out from all the wear and tear on it, but I didn't want to give up the activity.
A lot of times people that you might know would say to you, but wait a minute, if you got the surgery, your insurance covers that, but it's not covering your stem cells, right?
Yeah.
And you decided that you didn't care, you'd rather pay out of pocket just to avoid the whole surgical.
Yeah, I always knew if it didn't work, I could go the other route.
Right.
But I really didn't want to go through that much pain. I did physical therapy 3 times a week for 2 months. I followed the doctor's thing, and it was successful, but I just didn't like the idea of the pain.
Yeah. So you had 10 months ago or so, then you got the stem cell therapy, and what were the results? How did that work out for you?
It's great. My knee is free from pain. I used to always say, my right knee's the bad knee. Now my left knee's the bad knee. The right one's in great shape.
Now, you're saying free from pain. I mean, are you talking about 0 on a scale of 1 to 10? Or?
I'm saying most of the time 0.
Really?
Unfortunately, I was in a car accident a couple of months later and had a broken sternum.
Wow.
And so that kind of made my activity level non-existent for a few months during the summer, so I wasn't able to do a lot. But in the process, my knee never bothered me through all of that. Even after the accident, My knee never did really hurt.
Wow.
It was fine.
What were your expectations? Like, what were you hoping for?
As I said, I was hoping that the pain would be gone. I was still very skeptical. My wife is into a lot more of the natural type things. I never have been.
Mm-hmm.
I've always been the go to the doctor type of person, but I was willing to try something new.
Wow, so no pain. So I imagine you're back to your normal activities.
Oh yeah, I wasn't able to do it. The biggest thing I do now, I mean, I'm 66 years old.
Mm-hmm.
I used to play basketball, I played football, I played baseball, softball, I did it all.
Mm-hmm.
And there was a lot of wear and tear on my knees, my shoulders, and my arms. And I took up golf, and I love that. That's my sport of choice now.
Uh-huh.
But I try to play during spring, summer, and fall at least once a week. And that's a lot of walking.
Yeah.
But it's been great.
How long did it take before you started to notice a difference in your knee?
It was 3 or 4 weeks, the pain level was noticeably less.
Mm-hmm.
And then it just kind of gradually worked its way with the diet that we were on, the anti-inflammatory diet, and by following that and coming with the acupuncture treatments, it just kept improving and just continually got better.
So it's kind of the combination of all those things that they're putting together for you. So you had the cell therapy in your knee, plus the acupuncture, changed your diet, et cetera.
Yes, that made the difference. I think it was a combination of everything that they helped me through.
Yeah, and are you still noticing improvement even at this point?
I wouldn't say there's a lot of improvement now. I think it's pretty well, the pain's gone.
Mm-hmm.
And so I notice sometimes I'll do something. I mean, at my age, I'll maybe overdo it a little bit on something, but my legs get a little sore, but it's not the knee, it's the legs.
Yeah, and that's what I was talking about. In other words, you can you push it, more and more and find that it's holding up. And you just said it. It's interesting because you could say, hey, I can strain my muscles now and get them a little achy, but my knee's fine.
Yeah, and that's what's basically happened. I have an exercise bike at home, and I use that 3 or 4 times a week, anywhere from 15 minutes to a half hour a day. And I'm still trying to watch my diet. Wasn't as strict as it was, but I'm still watching my diet, trying to follow good eating habits, and it's just made all the difference.
So as far as other people who are doubters, or maybe even your orthopedist, have you ever given them feedback as far as what's happened for you at this point?
Oh yeah, I have a good friend lives around the corner from me that had knee replacement surgery, and before he did, I said, you ought to check into the stem cells. It's made all the difference with me, and I've talked with numerous people when people ask about anything, or I hear them talking about their problems with knees or shoulders or any joints really. I've suggested, check out the stem cells. It's not going to hurt you to go in and study it a little bit and check it, talk with the people that are involved with it, and find out. It might be an option for you.
How many injections did you have in your knee? Was it just one? Or?
I just had the one day.
Wow. Wow, so it seems like a lot of results for that one day treatment, I guess, plus all the other things. Yeah.
Well, it was kind of a happy birthday present because we came in on my birthday. So it was just happened to be, as a school teacher, I was on my feet all the time with my knee hurting. That wasn't good. But I took a day off of school for medical. We came in, listened to all of it, and I was more than willing to try it.
Well, Kim, I really appreciate you sharing your story, and I'm certainly happy about your outcome, and I wish you continued activity.
I'm thrilled. I'm looking forward to a lot more activity, getting back on the golf course.
Good for you. Well, thank you.
Thank you.